Hello, my name is Nawal Abdallah, and I will be discussing with you today about orthopedic impairments. Orthopedic impairments involve physical disabilities which could affect the academic process. Orthopedic impairments can stem from various causes. The National Institutes of Health Medicine Plus Medical Dictionary defines contracture as a permanent shortening as of muscle, tendons, or scar tissue, producing deformity or distortion. There are three orthopedic categories to describe the impairments, and they each contain a wide variety amongst them. Neuromotor impairments, degenerative diseases, and musculoskeletal disorders. The idea states that an orthopedic impairment is a severe impairment that adversely affects a child's educational performance. Children who experience physical disabilities can also have neuromotor impairments such as skeletal system, joint, or muscle or limb disabilities and qualify for IDEA. An evaluation is required for a disability to be classified as an orthopedic impairment. Exact requirements vary by location and state. This process generally includes a medical assessment performed by a doctor, however, to detect how the impairment may impact a child's academic performance. Orthopedic impairments are categorized by the diverse characteristics that occur. Strategies used should focus on the student's unique needs. Academic barriers may include non-accessible transportation, trouble maneuvering around the classroom, difficulty going around school hallways, earning mandated physical education credit, and communicating effectively with students, peers, and educators. Where the majority of students with orthopedic impairments are concerned is a matter of focusing on needed accommodations in the academic environment. Impairments may include cerebral palsy, muscular dystrophy, spinal cord injuries, and spina bifida as possible categories for orthopedic impairments. Cerebral palsy is the most common orthopedic impairment among students in public schools, with a prevalence of affecting 1 in every 400 births to estimate 500,000 people in the U.S. currently. Diagnosis includes testing infants' motor skills and examining mother and infant's medical histories. Some characteristics of students with cerebral palsy include difficulty with fine motor tasks. That could be maintaining balance, chewing, and swallowing. Also, involuntary movements, abnormal reflexes, weak or tight muscles, poor coordination, and speech difficulties. Muscular dystrophy is a disease that weakens muscles. There are 43 types of muscular dystrophy, with the most common being Duchenne's muscular dystrophy. This only affects boys because the genetic diseases are passed from mother to son through random mutation of genes. In the U.S., muscular dystrophy affects between 50,000 to 250,000 people a year. The number is on the rise due to technological advancements in earlier testing. Diagnosis can be through blood testing, muscle biopsy, or EMGs. Common characteristics of muscular dystrophy include frequent falling, difficulty getting up from sitting or lying positions, a waddling walk or gait, and fattening of leg muscles. Usually, wheelchairs are needed, and late to the teens and early 20s, respiratory and cardiovascular problems may develop. Spinal cord injuries occur when a traumatic event results in damage to cells within the spinal cord or severs nerves that relay signals up and down the spinal cord. In the U.S., approximately 10,000 new spinal cord injuries occur every year, and currently over 250,000 people are affected. This can occur at any point in life and usually occurs through a traumatic injury. Diagnosis is maintained through a medical professional after the injury. Spina bifida is a birth defect where an abnormal opening in the spinal column results in some degree of paralysis. There are environmental as well as genetic factors, including if the mother had a lack of folic acid in her diet during pregnancy and heredity. In the U.S., approximately 4 in every 1,000 births are affected. Spina bifida diagnosis includes ultrasound, amniocentesis, and there may be a buildup of fluid around the brain. Primarily, this is done before birth. When planning classroom design, be aware of mobility devices such as a wheelchair, a walker, or a cane, and place students where it would be easy to enter and exit the room. An IEP can be arranged for a student's schedule to line up to eliminate excessive walking or moving back and forth among classrooms and hallways. Assistive devices like screen reading software, speech recognition services are used to address the needs of students to be able to access the curriculum. Solutions to physical education requirements could be to correspond off of students' particular physical abilities. And academic software packages for students with orthopedic impairments may use devices for both positioning and mobility. Orthopedic impairments are very individualistic. Specialists might be needed to become involved in the development and implementation of appropriate educational programming. Awareness of students' medical conditions and its effect on the student also are beneficial to educators. Assistive technologies used to address needs of students in order for them to communicate may include screen reading software, speech recognition software, augmentative and alternative communication devices, academic software packages for students, altered pencils and pens, altered keyboards, power pads, touchscreens, eye-controlled input systems, and adjustable seats and desks, just to name a few. It is important for educators and future professionals in school settings or settings where they work with students with disabilities to be aware and open to finding accommodations and modifications to best support these individuals throughout their life and through their education.